open it up for questions.
Dr. Scott, with the outbreak at the ACI, people have been calling for lowering the population at the ACI to deal with it. Dr. Jennifer Clark, who is the outgoing medical director, said that efforts to reduce the prison population should be underway. What are your opinions on that?
We are aware of those thoughts. With the transition of the medical director care at the Department of Corrections, the Rhode Island Department of Health has been working closely to help ensure what's needed to quell the outbreak there has been taking place. We meet regularly throughout the week. We support the Department of Corrections and the approaches that are taken to help minimize risk of spread. And they know which units it's acceptable to perhaps think through those practices and which are not. So our focus is to support the Department of Corrections leadership, help ensure that there isn't any increase in spread, and make sure that our inmates and staff remain protected.
Right now, the DOC only updates the public at most once a week on Facebook. As part of the web update you just mentioned, could this be done more often so that people would have a better idea of what's going on?
You always also, as the press, have the opportunity to reach out to the Department of Health and the Department of Corrections. We can provide information as needed.
From people in the community, family members and such.
Yeah.
Has anyone died at the ACI from COVID that we know? Because we're not hearing those numbers either. And there's a lot of rumors coming out that people are dying. I'm hearing bodies dropping. So I'm wondering if anybody's actually died, if we know of that.
That rumor is not a correct one. We're working closely with corrections. We do not have scenarios such as that.
And lastly, a medical professional suggested that giving the incarcerated more time outside where spread is lower, perhaps using the National Guard to help with supervising more yard time might be a good idea. Right now we're keeping them cramped up in small confinement where spread is high, but if we got them outside more, maybe that would help. What do you think of that?
Thank you for that. We are applying all measures that are effective and able to be applied within corrections.
And Governor, do you have any opinions on using your authority to lower the prison population? I've been told that under Rhode Island General Laws 425618, you have the power to modify the criteria for reclassification and to temporarily grant parole, including medical parole or temporary furlough.
Yeah. So first of all, I like the ideas that you said before, and I'll look into both of them, both in terms of using the guard as well as the transparency. A few thoughts. I do not have that authority. I'm quite certain of that. Also, I think it's important to recognize that we're dealing with max security here. So earlier in the pandemic, I did work with the courts. The courts have the ability that you speak of to encourage the early release of a small number of low-level offenders who were within, I can't remember, 30 or 60 days of release anyway. This is different, that these are, in some cases, violent offenders, much more serious crimes. Having said that, the courts have that power, not I, and I don't think, given the circumstances of what we're dealing with right now, it would be appropriate.
Governor, you said one of the reasons that the infection rate of Rhode Island being the highest in the country is because people still are not following the rules. What evidence do you have to suggest that people are not following the rules? Was there a problem with Thanksgiving? Do you know that there were outbreaks based on Thanksgiving gatherings? What does the evidence show?
Yeah, so it's a great question. So I was showing earlier in the data how much mobility really increased in mid-September and then again in October. We know we saw a lot of issues around Halloween. Parties did lead to increases. Quite frankly, it speaks for itself. In other words, we know that when, you see it now even, like when mobility goes down, cases go down. When mask wearing goes up, cases go down. So, and also we know from the contact tracing, you know, while it isn't perfect, it is like clear as day when you can see one party. Like we have talked, you and I have talked about that one party in the East Bay verifiably led to, you know, dozens of cases. So that's what we have.
The percent positive has kind of gone down a little bit the past couple of days. So do you attribute that to the pause?
Yes.
do you attribute it, do you think people mostly did follow the rules around
Yes.
Thanksgiving?
That I don't know. I'll be very honest with you. I do not know. I don't know. That's a hard thing to know because it's hard to be in people's homes. But that tiny decrease in test positivity from just about 10 to 7%, yeah, I do attribute that in part to the pause. And you can see it in the mobility going down, which is why I want to continue the pause for one more week.
And just finally, you noted again, you said it was shameful, these schools that are going remote before the holidays. This comes as the unions want all the schools to go remote, and obviously you're going to get a lot of pushback on this. The teachers are very upset, thinking schools are upset. I know you've had the same answer all the way throughout. What do you say to them today now, saying it's shameful that some of these schools are going to remote when you let high schools do that, but you don't want to do it for K-8?
My position is just very clear on this. I feel for teachers. I really do. This is the hardest year they'll ever work in their careers. By the way, that's also true for doctors, nurses, truck drivers, grocery store workers, social workers, the DCYF social workers. It's a brutally hard year. And I in no way want to minimize how hard this is for teachers and the deep respect that I have for teachers and what they're doing. The harm that is being done to our children by not being in school is massive, and these children, in many cases, are going to face lifelong challenges because of it. So my job as the governor is to keep the kids in school and then to do what we can, passing out thousands of HEPA filters, testing more completely, providing more substitute teachers, providing the supports that we can to keep the kids in school. But I have thought from the beginning in this entire discussion, the focus has been more on, the focus hasn't been nearly enough on the downside to children of being out of school. So I don't have much to say. I am where we are. Also, look at the facts in school. I mean, we go into Central Falls, which has it's a very densely populated community. Test positivity is almost 20%. And in particular schools, our test positivity is less than 2%.
Dr. Alexander, in regards to you calling out some school districts who are going to remote learning, a lot of these school districts, or the unions have said it's because of staffing shortages. So how do you square the two there in your pointed message, and are you doing anything to sort of help those school districts get more staffing in order to bring the kids back?
Yes. So again, I'd say, I never said this was easy. I understand it's hard, so they have to find a way to be creative to solve these problems. If staffing is a problem, you have to get creative to solve it. If facilities are a problem, get creative to solve it. We have a whole command center, only state in America with a command center that does nothing but support our schools. With substitutes, I have asked Rhode Island to help these substitutes, and we have an amazing pool of substitute teachers, hundreds and hundreds of teachers. So yes, it's hard. We'll give you a hand. We have substitutes. Look, I don't think the question should be, is it safe to have kids in school? The answer to that is unequivocally yes. Ask any public health expert in the world, and they will tell you, yes, it is safe to have kids in school. Ask any parent or teacher or pediatrician, do kids do better in school? Unequivocally, yes. So the question is, what does it take to have the conditions in place for kids to be in school? And that's just work and creativity. More HEPA filters, more windows, more facilities, more teachers, more support. So let's figure out a way. Let's do what it takes to give the kids what they deserve.
Governor, I have a question for the governor.
All right, go ahead.
Dr. Megan Rainey, Brown University, she's on CNN quite a bit. She basically laid out all these different scenarios, but couldn't pinpoint one reason why Rhode Island was considered number one.
Yeah.
So, Governor, isn't it possible that, we're between Connecticut and Mass. I see people wearing masks. You've been proactive. You announced the pause.
Yeah.
Is it possible that, as much as you say people aren't following it, it seems just to be a mystery to medical science of why it's spreading so rapidly.
Yeah. So listen, I think there's some truth to what you say. I'll say this. If you look at cases per 100,000, we're number one in America. But if you look at test positivity, which accounts for the fact that we test more than most states, we're kind of middle of the pack. Like, our test positivity is average in America. So you make an excellent point. And some of this stuff is out of our control. We're densely populated. You know, there's no really rural Rhode Island to speak of. Densely populated, a lot of multi-generational homes. Now, mom, dad, grandma, grandpa, aunts and uncles, all in one home. Lots of people in nursing homes, lots of older people. So, yes, I think you're right. And I think that's what Brian was getting at, and maybe I was wrong in saying, you know, it wasn't rule following, although there's plenty of that. Our test positivity is kind of in the middle, and that's because we're testing so much. But what I do know is this: we can't stay at this pace. You cannot have 70 people going into the hospital every day. I've got to stop that, because we won't be able to, hospitals and the field hospitals will be over full, and that's what I have to prevent.
And just speaking of the hospitals, Governor Baker announced they're going to stop elective surgery en masse. You've hesitated to do that, but you also mentioned the field hospitals are wildly expensive to operate. Is that something that you're looking at?
No, not at this point in time. We are in like daily contact with the hospitals. We're going to let them manage it. We're going to let them manage it. I'm not going to tell them how to manage it. We have the field hospitals. They're shuffling, and we're not there yet.
Doc, can you take us inside what major changes you're making? Let's say, okay, we're in the one metric, we are the worst in the world right now. Other metrics, we're in the middle of the pack. Either way, it's not very good right now.
Yeah.
So what was rolled out today isn't a very significant change from where we've been, and certainly if you look to a week and a half from now, it looks like we're going to be loosening up some restrictions. What changes are you making to get the numbers dialed in?
Okay, good question. We're continuing the pause. Like I said, the early data suggests the pause is working. Traffic's down, mobility's down, test positivity is down. Not significantly, but it's not up, it's down. So I think the pause is working. Let's stick with it for another week. Secondly, we are like tripling testing. That's huge. Don't underestimate that. Thirdly, we are deep inside our high-density communities, all over Central Falls, parts of Providence, and Pawtucket, deeper than we've ever been. Testing in the community, in church basements, in schools, in, you know, there, renting additional hotels to allow people to isolate safely in those communities. So it's a combination of the pause, but also the testing, and then super pinpointed in these high-density communities.
Does that include the nursing homes and the prisons and any other congregate care facilities, or is that just zip codes?
When I say high-density community, I mean primarily Central Falls, parts of Providence, and Pawtucket, so I guess zip codes, where our test positivity is still high. But we're also making changes in nursing homes. So, for instance, in nursing homes, we just opened our first 3 isolation units within 3 nursing homes. That's new, right? So we're getting better at putting people into isolation units within a nursing home.
Dr. Governor, we're seeing small businesses defying some of these regulations around the country. We've seen it here locally with gyms. As you extend this pause, are you prepared to see more of that, and how would you handle that?
Yeah. Listen, the reason that I decided to extend the economic relief with the pause is to try to prevent that. It's really hard for them to obey because they lose business. So to make it easier, I'm sending money out the door. We have not, thank God, had a lot of the problems of other states with full-on refusal to follow the rules. I think some of that is because we're sending money out the door at the same time. But listen, if people don't follow the rules, then we're gonna require them to do that. You know, we've had some lawsuits, and we'll continue to defend the rules.
Dr. Alexander-Scott, good afternoon. So the quarantine revisions that you talked about, that's a reflection of what the CDC has talked about, right? In terms of the lowering and the quarantine and the testing and all that, right? At the same time, the CDC says there is no indication that indoor swimming pools are a cause of spread, yet the state has lumped them in with other indoor sports facilities. So how do you square that with, there's an aquatic center in East Providence that has state-of-the-art filtration system, has put up plexiglass, done all of those things, high chlorine count. How do you square keeping them within other indoor facilities with the closure? And why wouldn't you consider that specific subsection of indoor facilities to remain open?
All of our decisions are a balance. It's based on guidance that we've received, but it's also based on our own local data and also our understanding of the virus and the science behind how the virus spreads readily. We wanted to have the pools that are a part of gyms follow the same alignment, except if someone is using a pool for therapeutic reasons. If it's needed for those reasons, that has been allowed in certain situations. But if you think about it, the virus spreads more when you're indoors, in informal settings where you're not able to wear a mask, in inconsistent groups. Where pools are, the smell of chlorine is even stronger when you're indoors. It's a sign of what's happening with the air. It's harder to ventilate adequately. You're breathing harder if you are swimming there recreationally or for other forms of exercise. And so we wanted to take the major scenarios that are at increased risk of causing super spreader events and pause, minimize them during this time frame. As we go forward in the phase after that the governor shared, we will be addressing it, but during this brief time, that was the driver behind our decision.
This particular place is not associated with the gym, and it's a standalone aquatic center. Your department is familiar with this place because they've had much interaction with it. I don't know if you or anybody at the health department who's making these decisions is actually a swimmer, but when you exhale into the water, and you're not near anybody, and you wear a mask right until you get to the pool. So all of what you say sounds fine in theory, but in practicality, it doesn't stand up because they have high filtration, the doors are open, and all of that. So, you know, the easy way for government is to say we're going to put everybody into one category because the science says, and the huffing and puffing and the breathing. The more difficult thing is to look at this specific business and any other like it and say, you know what, maybe we should carve out an exception. They have 1,800 people who use this facility.
Yep. It's certainly something that we understand. We made the exception for those that use it for therapeutic reasons. And though people are breathing into the water, when you come up, the air there, it's more challenging, it's indoors for a period of time, it's the type of environment that is conducive to increased risk of spread. During this brief time period, it was part of the decision making that we made.
Governor Raimondo, with regard to dollars and cents, you and I have spoken on a number of occasions about shared sacrifice, austerity budgets, the notion that as the small business infrastructure in this state literally is collapsing around us, for admittedly exogenous reasons, there was at least the expectation that there would be some type of financial responsibility. Instead, the state has delivered effectively a $12.7 billion budget, increasing the budget, guaranteeing no state layoffs, or allegedly no cutbacks in salaries or overhead, in a state that's got a GDP growth pre-COVID that was less than half of the national average, in one of the worst funded pension states in the nation, and that's not even counting city of Providence, in a state that is virtually on the verge of collapse, arguably, of course, exacerbated by COVID. At what point in time does the state exhibit any sort of financial responsibility? By the way, we're talking about $400 million more in bonding that will probably be passed. You're saddling the state with a bonding level, a debt level that's roughly equivalent to its annual budget. At what point in time do we recognize reality and try to ask the question of the year, who is going to pay for this?
Yeah. So listen, it's a difficult budget, and I give the General Assembly credit for coming back and trying to pass a budget. There are numerous cuts in this budget and in every budget we've passed in the past number of years. There are no tax increases in this budget, which was important to me, and I know the Assembly, which is different from many other states, and I think it's very important to not increase taxes. In fact, there are some additional tax cuts in the budget. And I support the bonds. I support the bonds. It's investments in affordable housing. We have a housing crisis in Rhode Island, and during a health pandemic, people need and deserve affordable housing. They're investments in childcare, investments in pre-K, which our children need. So, again, we have disagreed in the past. I agree in the necessity for fiscal responsibility, and I have made a lot of hard choices as governor and as treasurer to try to be fiscally prudent. And every budget that I've signed has involved tax cuts for the people of Rhode Island. But right now is not the time for austerity. And don't just believe me. Talk to the chairman of the Fed, talk to the economic experts. The danger now is not investing and passing an austerity budget. We got to get Rhode Islanders back to work. And that $400 million of bonding is going to put a lot of people to work. So I think of it as investments. If the federal government doesn't come through with the stimulus, yes, furloughs are on the table. I honestly don't see how we get through it without it, and many other, more difficult cuts.
They were talking about budgets that are quote-unquote being cut, but the number is rising exponentially. And again, the central question is, in a collapsing business environment, who's going to be left to pay for this?
Okay, again, I reject the premise. This isn't exploding or collapsing. We are in a crisis now. We have an economic crisis as a nation now. I happen to believe part of the way out of this is to invest. And that creates jobs in the short run and in the long run. And when you say who's going to be paying for it, that's why I keep referencing taxes. I think it would be a terrible time to raise taxes on, everyday Rhode Islanders. And so we're not going to do that. And we're going to cut accordingly in order to make that possible. But we also need to invest in health care, housing, child care, clean water, because I think that'll pull us out of recession and make sure the recession isn't so protracted.
Governor, your plan is to partially lift the pause after week 3. What if the data do not improve or they worsen?
Listen, from the beginning I have said I'm going to govern based on the information before me, and so I always reserve the right to make changes. If they worsen substantially, then I would have to make a change. It's hard to believe that would happen in the next week. I think we have a pretty good sense of what it's going to look like in a week. And also, the next phase is just a slight dial-up. And it's hard, to the question we were just talking about with gyms and pools. I want to get them back open as fast as possible. And they've suffered enough. So long story short, it would have to deteriorate significantly in a way that I don't now anticipate in order to extend the pause again.
Last year, presidency.
Governor, just a couple of high school sports questions. At a time when you continue to stress about the importance of in-person learning, what are some of the hurdles that your office is kind of dealing with to at least allow kids to, at the very least, practice? Especially with a lot of kids, as we know, come to school because they participate in sports.
Yeah. So I should have said this, so thank you for the question. We're in pretty much daily contact with the Interscholastic League, and they, as I understand it, they were waiting to see what I said today, and then they're going to come out with their own plans for the winter season, and we'll support them to do that. They've been fantastic. They have been following the rules. So I can't speak for them. I don't know what they're going to come out with, but we want to support them to help the kids, play, as you say, even just for practice, as much as possible. So I'd say call the Interscholastic League, and I think within a few days they'll have more guidance.
Governor, you talked today about keeping gatherings small, if at all, for Hanukkah, as you did for Thanksgiving. Do you anticipate this guidance continuing through Christmas?
The big question. So Christmas is still 15 days away, and the rule is stick with your household. So I would say for the purposes of your planning, you should be planning a small household Christmas. You should not be traveling, and that is what I will say.
I have a quick question about vaccine distribution, if you don't mind. Either one of the doctors, whatever works. I'm just curious as to why the state isn't going to be administering this when you have all of the structure in place.
Yeah, so it's a great question. So the state has a lot of people in place for swabbing, but not necessarily for administering vaccines, which tend to be additional healthcare trained people. So we're going to work with the healthcare system, and especially in the places where we're looking to get that out first, such as hospitals, long-term care facilities, all of which have medical directors and nurses. It kind of makes sense to work off existing infrastructure.
Is there any thought in the plan to putting the vaccine in some of these high-density communities that have been hardest hit first? I didn't see that in the chart. Is that at all part of the consideration?
Absolutely. Well, so for phase A, we're going to prioritize the hospitals and the long-term care facilities. But as a second step, absolutely, in all following steps, we really want to prioritize, similar to testing, we want to prioritize vaccine in those areas, and we'll be setting up distribution plans and working with clinics in those hotspots.
Doctor, the hospitality groups in the state put forth a recommendation today that they'd like to see their members vaccinated towards the top of the pile. Is that appropriate?
So it's a great question. You know, the vaccine subcommittee is looking at all groups, all populations, and we're certainly willing to consider. And it's something that the broader vaccine group will weigh in on.
Doctor, can I ask you about the phases? If I'm reading this correctly, I fall April to June, and unless something's done. But apparently in phase 2, murderers at the ACI, they're going to receive it in February. Is that a typo, or am I reading that correctly?
No, so the ACI is a congregate living setting, and I think from a previous question, we are having outbreaks there. And I think ethically, we have to vaccinate that group. We have to take care of that population. We are fitting them within the scheme of vaccination that makes sense for that group. And certainly, again, let's keep in mind here, right, that we are on the upward slope of a peak. I think in the near future we're going to come down, and vaccines along with masking and physical distancing and everything else that's being recommended, that's going to hopefully accelerate that downward curve and flatten it out, hopefully forever, and that will be the end of the pandemic. So vaccine is one key, one part of it.
Just one question about the vaccine. I'm reading that you can't drink for 2 months, and also that a lot of people felt lousy the day that they had the second one. Is that consistent with what you're seeing?
So there's still, I've heard, and based on reports that are coming out, we do know that people tend to feel a little bit worse after the second dose. And again, that's attributed to the fact that people's immune systems are reacting in a positive way and building up antibodies. But there's still a lot that we don't know about this vaccine and a lot that we're learning. So there's a lot more data to come. The CDC, the ACIP will be reviewing all of this and issuing firm recommendations on who should and shouldn't be getting the vaccine.